Finalizing a monolithic crown. As we have used a perforated block to produce a monolithic crown, our monolithic crown has a hole which has to be closed. There are two different ways to close this hole: using ceramic products by firing or using a composite resin. The latter can be done in the dental lab or in the dental office. In this video, we will see how to close the hole of a monolithic crown by using a composite resin. First off, we need to prepare the two surfaces, the tie base abutment and the lithium disilicate crown. We take the abutment, protect the tapered connection to avoid any damage to it, and sandblast the abutment surface intended for gluing to the lithium disilicate crown. Then we apply for 30 seconds an etchant, 5% hydrofluoric acid, to the crown surfaces intended for gluing in order to create the correct interface for the luting composite we will use. Here we will use multi-link hybrid abutment cement produced by Everclar, a specific luting composite developed for the permanent cementation of ceramic structures made of lithium disilicate to titanium abutments. There are also other luting composites, but I like this one because it is very opaque and thus avoids shimmering of the underlying metal. After having prepared the two surfaces, we apply the luting composite and position the crown on the tie base abutment, making sure that it latches into the rotation and position stop. In this case, we can seat the restoration onto the analog in the dental cast. In this way, correct placement is confirmed, and it is much easier to work on the occlusal portion of the crown. First off, I better distribute the luting composite in order to cover all the dark parts. When everything is dry, I apply the composite. I distribute a little bit of liquid opaque. Because I use this material produced by 3M SB, polymerization is required. There are also other composites which can be used. I spread it within the hole, then I use an opaque dentin to better cover the hole. I distribute it carefully, I shape it, and polymerize for 4 seconds. Now we can add glaze or stain material to optimize the final shape and color. Naturally, the curing time depends on the type of composite we use. We make some characterizations and fissures to better cover the hole. Now it is no longer possible to see the hole. In case of angled monolithic crowns, it is recommended to close the hole in the patient's mouth. This enables us to use the hole for tapping the abutment along the implant axis, as the hole is necessary coaxial to the Morris taper of the connection.